Oh man.
I gotta make sure I see you guys in case get power outage.
Oh man. Okay, let's see. Where the heck is my comments? What's up, everybody? Aloha Friday. Aloha Friday.
Yep. Aloha Friday to all of you. How you guys doing? Let me turn off my search lights.
Okay, here we go. I'm not showing comments again. What the heck? There we go. There we go. We are set.
Whew.
Susan, Lola, Melissa, Leona. All right. How you guys all doing, guys? What's happening, man? I know we only got a few of you on, but here we go. Stay safe. Hashtag stay safe. I don't even know where to start. The first thing, Charlie, how are you, my brother?
Yeah. By the way, this is aloha with an exclamation. Okay. This is not aloha.
I like that.
This is
In fact,
aloha.
yeah. In fact, I'm going to put that on mine too.
I'm doing okay, my brother. I'm doing okay. This little
I like to do that too. I stole yours, Charlie. I stole it.
aloha. Aloha.
Hello, hi. What's up, everybody? Thank you guys for joining us tonight on this Monday evening, start of a new week,
Yeah.
the eve of no more safe travels for Inner Island, guys.
Yeah.
Tomorrow, well, tonight at 12:01 a.m., safe travels for Inner Island is gone, is no more. So we are free to travel around the islands without any testing, without any vaccination, with just like pre-COVID. And I don't know how you all feel about that. I know some people are very very excited. I've been reading the comments. I didn't count how many's excited, how many's afraid, but I can say it's a mix. And we knew this day would come, Charlie. We knew that this day was going to come. What's
Yes.
ironic about it happening tonight
Yes.
is
Tell them. Tell them. Tell them. Yeah.
the Delta variant is here. Um, and I want to wait till we get more people on because I know it's still 8 minutes before 7, but I just wanted to have the pre-discussion, Charlie, just how you feel. Charlie and I, we don't talk as much as we used to. We all been busy,
Hmm.
so
Yep.
we actually talk more live than we do offline and
Yeah.
now.
Yep.
We've spent so many hours together over the last year and a half, like a lot of hours. But I was just curious before we get officially started, what's your thoughts? I know we all knew that uh, June 15th was going to be the day that Inner Island was going to open up. There was talk prior to today. In fact, as recent as yesterday, an article was written about how everyone was concerned about the Delta virus, the variant, and that we hope that it wasn't going to come, but that if it did, it would impact the numbers of cases. I mean, that was day before yesterday. Well, today, the Delta variant was identified from someone that traveled to Nevada, took a safe travels test, negative, came home, and 3 days later got sick. I like the way they stress the mild symptoms. Bottom line is she got sick, she was fully vaccinated, and she got the variant. That was announced today. Tomorrow we open up. What's your thoughts, Charlie? What's your thoughts, man?
Well, you know, it's just a confusing matter. I understand that we needed to get some kind of flexibility. And everything is really based on this honor system, right? You've heard Mayor
Totally.
Blanchiotti talk about it. You've heard, I mean, everybody has talked about it. It's got to be an honor system. Well, I've, as you know, I've been in the tourist mecca this past week, and I just see tourists going up and down. I gotta say, over half wear their mask, but for the most part, the rest just walking up and down, coughing all over the place. And I'm just one of those that you hear a little cough, you just avoid. But the way I feel is because Delta has made landfall, it 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 did a pretty heavy damage in the Middle East, and I don't know why they don't look at that. But again, they're blaming the fact that those countries didn't have that much vaccination. Rightfully, maybe, but the same token, you just said it now. Here you have a person that's fully vaccinated and basically sought medical attention, right? That's how it was discovered because the the test prior to gave them negatives, gave them a negative. So if that person did not seek medical attention, we would have never known. We would have never known because they already had a negative test. So that's how
And if you look at the timing, 3 days after this person came back home, that the exposure could have been in an airplane, could have been at the airports, could have been at the rental car in Nevada, could have been anywhere. Apparently, the exposure came early enough that it wasn't detected in the test, the pre-travel test.
but manifests itself there.
Yeah, exactly. But by the time that person came home, plus 3 days, she got sick or he got sick. And that's the danger, yeah, of this thing. Now, that is with safe travels in place. That is with the test or quarantine for people that don't take the test. Now, we're at 55% vaccination here in Hawaii. That means 45% of the population is not fully vaccinated. Not fully vaccinated. So we're going to have these visitors coming over, like this one that just happened, that may have passed got their negative test result before they came here, 72 hours before.
Mhm.
And then they're free to roam. 45% of our population. I remember I talked about this on Friday. The 55% is an average. That's statewide. You take the number of people that got vaccines and you divide that by the people that live here. So um, we don't know the pockets. And in fact, today, the Department of Health did a press conference. I watched it live on KITV, had it on Facebook. I shared it. I hope you watched it. If you didn't, just go back to my page. It's about 18 minutes long. It's not long at all. So when you go listen to how minimizing the state is. Now, the lab director, the guy in charge of the state lab.
Looked very nervous.
Exactly. You read my mind, Charlie. He was concerned. He
He,
was
you know,
concerned. Now,
he looks like a very he looked like a very nervous Alfred Hitchcock.
yes.
His tone was very mild, and his job is to run that lab, and whatever comes, right?
Mhm.
And yet you could tell that he had to be the bearer of bad news on the news, and he just like, I don't want to say it, but I'm going to say it, and I don't know because he actually said it prior to it, hitting. Remember, he said that since we're going to open up, we just hope. He talked about the Delta variant when it wasn't on island yet or in the state, and that he didn't want it to come. He said, we don't want it here because we definitely gonna run into problems. Now, this is one guy that specializes in that kind of stuff. Then you got ER docs that figure, we got to deal with the backlash that if somebody does get sick, right?
Yep.
What do we do? And so you're right. You're right, Mel. You're
Well,
right.
I mean, the epidemiologist, what's her name? Um,
Kimball.
Kimball or whatever.
Kimball.
She was very nonchalant. She was very minimizing. She was very like it's not that bad. Um, she said that the science is still out on whether or not this variant is more dangerous, more transmissible. I mean, I don't know if the science is out. I think if you follow the science and you listen to the experts, it's pretty clear that this is a very dangerous variant, and we're talking about a population that is just about half vaccinated. Yeah, Dr. Kimball. Thanks, Liz. Um, so we are playing with fire again. We're playing with fire. Remember, Dr. Capone? I think it was your Charlie. You brought it up, Charlie. The hay or the straw and the match. I mean, the straw is this thing is a problem, and it's scary. And even the lieutenant governor today on this evening's news looked a little nervous, but he will not um,
Back
come
down.
out and acknowledge how dangerous this is. He basically is using this as an opportunity to get more people to get vaccinated. That's the overall solution. And don't get me wrong, yeah, the vaccinations are very helpful, but there's a lot of people that are not going to take that vaccine, and that's going to leave a puka in our population that's going to be very vulnerable. Now, you could say, because I've heard it, I've read it, I've seen people say, well, if they don't like get the vaccine, that's their problem. No, no, it's not their problem. It's all our problem. We have kids that cannot get the vaccine. We have people that have medical conditions that cannot get the vaccine, that their doctors are not advising. We have people with strong religious beliefs. So it, the bottom line is that's a horrible thing to say. Well, it's up to them. If they don't like take them, they suffer the consequence. No, there's many valid reasons why people are not going to get this vaccine. The
Well,
funniest thing I heard, this is, and you go back and watch this. It was on the news. I think it was in the press conference. They asked Kimball, aren't you concerned about opening up travel? She goes, I'm not concerned about opening up inner island, but there is a concern about the trans-Pacific arrivals, bringing this virus or the variant from pockets of places in the mainland that this has become the main strain. Okay, let's dissect that statement.
let me say something before you do.
Okay,
This person is a wackadoodle, plain and simple. You allow it to come into the islands, and yet you don't worry about it spreading amongst the islands. Hey, sister, why don't we let it go to your house first and let it incubate with you for 14 days? Then come back out and tell the greater population how you feel. I mean, it's like saying, okay, we got serial murder, right? Instead of closing off the borders, we got serial murder. Once he's inside, don't worry. He can be right next to your kid's school. He can be right next to your house. I mean, that's the logic behind it, and I don't get it. I don't get it. Okay, continue, my brother. Continue.
no, I just say you dissect that statement, but before, let me address this. Marie just said she heard our vaccine numbers includes tourists that get their vaccines here. I am under the impression that the numbers that they are putting out is include all vaccines. So if a mainland, they're not divvying them up. It's how many shots went out, and I could be wrong. Somebody correct me if I'm wrong, but I was told the same thing, that they are counting every single vaccine given in our total numbers. So yeah, well, I think that's a small number, Marie, but I think that's a valid point. They need that's a valid point. But anyway, let me get back to Kimball's statement. If you dissect that statement and said, I'm not concerned about inner island travel opening up. Well, of course, because that's what the governor wants. That's what the lieutenant governor wants. I cannot sit here and trash them. But the trans-Pacific travelers coming into the state are concerning. because they may be carrying a variant from one of the states that have pockets of low vaccination rates and high variant counts. Now, really, Charlie,
Mhm.
roast pork causes high cholesterol. Whether you eat that pork here in Hawaii or you eat that pork on the mainland, the pork doesn't doesn't clean itself because we're in Hawaii. You're gonna get a passenger from San Francisco where this Delta variant is starting to pick up. You're gonna get a visitor that's gonna come to Hawaii. They're gonna land on Oahu. They're gonna spend a couple of days, 3 days. Then they're gonna get on an airplane, inner island, and they will take no tests. They will get no proof of vaccine, and they are gonna go throughout the state. I'm only talking one person from San Francisco. We are getting what, 30,000 people a day coming into our state. So that's what the hell that makes no sense. Inner island is okay, but the Trans-Pacific concerns me. Sister, the Delta is here. It's in our state. You need to be concerned. Stop trying to soften this thing to suck up to the governor's decision to open up. I mean, really. I'm sorry, Saber, 41,000 people coming in a day, and more than I thought. My point is this: this variant don't give a damn who you are, where you're from, what color your skin. Doesn't matter if it's from Honolulu or from San Francisco. Every day we're going to have this incoming group of people. And remember now, a lot of these people are our local residents that are traveling to Vegas and to everywhere else for their vacations. And I'm not knocking that, but it comes with a risk. It comes with a risk. And we need to pay attention to that risk, especially now with the variant, with the Delta variant. It is more transmissible. It is more, it causes more severe illness. I don't know where Kembo gets her information, but
Well,
if you watch that today, you walk out of there thinking we extremely safe. And I wish they would just be real with the people, Charlie. I wish they would be honest and truthful with the people of this state.
if you were to do a comparison from before and now, before she was one of those that said, we got to take all kind of precautions. She was the very one after Sarah Park left, right? Now I can see them looking at the fact that okay, we are basing our medical opinion, or as a researcher or a scientist or whatever you want to call them, because they're not family doctors. She's basing everything on just the numbers that everything is driven down, like what Dr. Kim said. Okay, but he also said, but you still have to be cautious because we don't know. We don't know about the efficacy, right? They know about some of the other variants and how the vaccines react on them. But this one, they clearly state nothing is deterring this thing from steamrolling forward. They have no evidence right now that it's slowing it down. Now, who am I to go against that? All I know is, brother said, like on bowling ball coming down, in Wilhelmina Rise, you know where that is, on Oahu.
Yes, I do.
By Kaimoki, you look up, get that big hill. Okay, you get Sierra Drive that kind of winds like this, and Wilhelmina goes straight up, right? You
Mhm.
try to roll one bowling ball, 3/4 way down, I tell you, no, go try to stop the bowling ball. The bugger coming at you at 80 miles an hour, whatever, on 16-pound ball. Tell me if you're going to stop that. You're going to get a couple lumps, but, and maybe you're going to stop them, but you're going to end up at Queens Medical Center for sure. That's what we're talking about with these things. These things are going to steamroll. And I don't know if we have anything right now to cut the legs from under it, for slow them down. See, if we did, right? If we did, then I would say, yeah, we got something in our arsenal to slow this puppy down. But all the experts right now are saying they're concerned. I mean, why are they concerned and she's not concerned? Why is the medical community concerned and she's not concerned? Because she made a determination. Whatever happens on that, I think she has the attitude. It's not my problem. You guys get paid the big bucks for treat patients. Hey, come on, that's not fair. Nobody asked for it.
Yeah. It's sad. I mean, I still believe till today, and I've said it in the past, that our leadership decided on a date, right? They wanted this to be wide open by the 4th of July weekend. Nothing was going to stop them. Um, and you would think that the message today, once the Delta variant was talked about, it was discovered, that there would be some sense of concern, number one, and maybe some warning to the public that uh, we are now reevaluating, that we're not going to change right now, but be prepared because this variant is dangerous. It is here. It is highly contagious. But no, it's not. It's just moving right along. In fact, they're using this as another um, justification or a push to go to have everybody get vaccinated. And I think that's this disingenuous because the fact is that this is serious. And I think Dr. Jerome Kim, who was on our show last week, made it quite clear. I mean, he made it clear, and apparently uh, everyone else listens to him except our state. We are constantly, constantly talking about how we're okay and that we'll get through this because of our 52, 53. Now today they said 55% vaccination rate. Well, when you're dealing with half of the population that's not vaccinated, and if this variant gets a hold of a community, how then what? Then what do you do, Governor? What, you gonna just say sorry? And I mean, we knew there. No one can tell me that our experts at the Department of Health and in that governor's office didn't figure out that Delta was going to be here shortly. I mean, it's just follow all the other variants. Once it was found in California, within a week it was here. That's how it works because we got so many people traveling. They did they had to have known that it was going to make its way here. But it's if you watch the news and the press conference, it's like it's just another one of the mild variants that they're not concerned, and that scares me, Charlie, and to our viewers, that scares me because they are on a predetermined track. I mean, they're on this track to open, and nothing is going to stop them or deviate. Not going to change their mind. It's almost like the real project in Honolulu. No matter what the problem is, it doesn't matter because the decision was already made that regardless of the cost. See, the difference with the rail, you're talking money. When you're talking about COVID and Delta and all these variants, we're talking about lives. That's the big difference. But the attitude is the same. We're going, we're moving. Mel and Charlie, you can bitch all you like. We ain't listening. You can bring on Jerome Kim. We don't care. You can bring on Dr. Altenberg. Who cares? We can bring on all the experts. We don't give a damn because we're moving because we got to open by July for 4th weekend. That's my overview. That's how I see it, Charlie.
Well, one thing I can say with certainty, we it's quite evident. I mean, it's quite evident that we do not have a defensive mechanism whatsoever. Every time something was announced that we had to be careful, we set up these programs, right, to stop it in its tracks. True? It still gets in. That's why today I was talking to a non-believer who said, I gotta say this. Even though I'm skeptical, I'm just wondering, why are there still cases? And I go, that's a good question. I mean, I would love to see the cases go to zero, right? But it's he was person who was talking to me just said, I just want to know. He said, I'm a pessimist. He tells me, I'm a pessimist. But why are there still cases? I says, I don't know. I don't know. What does it take to allow cases to bypass the safety net? Very simple. Don't have to do much. Just wait till the safety net comes down. You don't have to do much. Just let the safety net come down. Then you watch how the state is going to go into a reactive mode. Okay. If they got to start reducing the tiers and disrupting people's lives because you're giving so much people that sense of non-vulnerability. But we know that we're all vulnerable. Watch when they start scaling, what are they going to do? You haven't fixed the unemployment situation yet. What are you going to do? You're going to ramp that up again? It's bad enough. The payment system was all out of whack. He basically were rewarding people for staying home. That's why he paid them that high amount. And what happened? We can't find workers. So the plan is everything has a domino effect. You just need to know that once you push that first tile, you got to know where the last tile going to end up. And I don't, this state has always played it that, let's roll the dice. Let's see how a few tiles fall. If all the tiles start falling a certain way, you cannot consider it a success. You're like, hey, there it goes. Wait, you still got about 3,000 more tiles to knock over before you reach the end. It's like football. Remember we were talking about how they celebrate after that first touchdown. Brother, the game not even over yet. Celebrate when the game is foul, right?
Yep. Yeah.
So,
We again have been beating this thing silly, and we're gonna ride this thing out, and we're gonna have to, again, as we've said for so many months and months and months, that we're gonna have to rely on ourselves. I just wish that there was some sense of urgency, or uh, a more accurate uh, message coming out of our state leadership. I just wish they would come out and be real and be honest, like everyone else is throughout the country, even in states that are doing quite well as the numbers relate. This Delta variant has scared a lot of people,
mhm,
and my biggest fear, we talked about this way back, where when if in fact it gets to a point where we got to start shutting down again. I mean, look at the mayor of Honolulu. He opened up bars and nightclubs. I bet he's, and I could be wrong, but I would think that right now he's probably concerned, because those are the kinds of venues that create big spreads when you get exposure. So I'm wondering what they're thinking. I wonder what these guys all are thinking tonight as they go sleep tonight, knowing that tomorrow morning, by the time they wake up, the flights would have already been flying for most of us. I wonder if there's any concern in their brains about, oh my God, what's going to happen if we see some spikes? What are we going to do? I honestly don't think they care. I think they will blame the unvaccinated people, like they did with the prison on the Big Island. They went right after those guys. They're not vaccinated. And your point? What's your point? Okay, they got COVID. They have families. They're human beings. Why you divide people? You vaccinated versus unvaccinated? It doesn't matter. We are creating an environment for this virus to spread, and we're actually creating a much more vulnerable situation when we open up travel.
mhm.
You know what I'm saying? It's crazy.
I kind of would like people to think about this. I know that everybody watches this show. I'm a firm believer that they've heard us make the last pitch about safety, whatever it takes to be safe. And I believe they will. If all of you can just get a hold of one person that's not watching and just tell them to be safe, because we're not going to change this state. There is no way. They've been off the rails for some time. And while they're trying to convince us that the ride is smooth, it's not smooth. You know it, and I know it. And we have to depend on ourselves. We have to depend on our wireless, coconut wireless, amongst each other to build up the defenses that we need to fend this virus off, or this variant. And I just hope and pray those of you that's watching tonight, grab a person that's not watching and just tell them, hey, trouble times are ahead. Nothing to go overly off the edge, but it's like saying, you know, there is a neighborhood that's very dangerous, high crime rates, high assaults. Would you want to go 10, 11, 12 o'clock at night to walk in that neighborhood? No, right? And so is with this virus. Would you want to play with this thing? You don't even know what it can do yet. You don't even know if you have enough of the vaccine in you to build up those antibodies. Because right now it says nothing is stopping it. They've said it already. And yet we have experts like the DOH saying, well, the jury's still out on this one. Okay. But guess what? We're getting sick people. Maybe not as bad. I hope I hope they get better. But what if they don't get better? And that's all I'm asking for, is that you just let somebody know, because you don't have to allow people. I mean, that's why we out there, we watch for our kupunas. We know that they lived a good life, but yet they don't move as fast as they used to. For the Kanes, they don't punch as hard as they used to. Well, this variant is something that's new to them. Can they outrun it? Possibly, but most times they can't. So we got to think about them. We got to think about our children that haven't even gotten vaccinated because they can't. We got to think about those medically they want to take the vaccine, but they can't due to medical conditions. You've got all of these uh, groups that, for all intents and purposes, they can be vaccinated, but they can't for some reason or another. Then, of course, you got those that just don't want because they don't believe in it. But what about the ones that do really want to take it, but for some reason it'll be too harmful for them to take it? How can they protect themselves? We got to find a way. And we got to keep them far, far away. We got to do our part, right? Keep everybody safe, keep everybody far, far away from this thing. The only
Yeah,
sad thing is we will never know when the final bell rings to say, okay, we've beat it. We won't, because this state plays with too many numbers. They roll a dice, and if it doesn't come out in their favor, hey, who knows what goes on behind closed doors, right? Very easy to say, no, things look good.
yeah. It's scary times. I think a lot of people are really concerned, and I know a lot of people went out and got vaccinated. Did you enter the contest, Charlie?
Yes, I did, and I won.
No, you didn't win. Not
I
yet.
did.
They're gonna announce
But
Wednesday.
no, no, no. All of us that did win, they gave us the email that we won.
You know, I signed up Patsy and myself, and I hope I win the big one. Um, I hope I win the 100,000 miles or whatever it is from Hawaiian Air or the Zippies for a year, whatever it
Yeah.
is. If I win the miles, I'm gonna donate them to a nonprofit. If I
If
win
I
the
win if I win the Zippies one, I will donate my farts to science, because I going for a year of chili. That's all I'm gonna do. I'm gonna drop them.
I could really, I mean, we didn't even have a Zippies here on Kauai, but I would love the 1 year of Zippies. Ooh, the Zip Pack, the fried chicken, they're chili. They're chili with the hot dog. Oh my God.
Chili Frank. Yep.
Yeah, the chili frank. Yeah. Yeah, but I hope I get the Yeah, you see, Sally, she cannot get the vaccine because of chemo. Praying for you, Sally.
Yeah,
We're praying for
yeah.
you. And but again, there's just so many reasons. I think what bothers me the most, and I've said this so many times. I'm sorry if I'm sounding like a broken record, but it's just a lackadaisical approach of the state when they know for a fact that many of us pay attention. I know a lot of people stop following it already. They just stop following it. They just don't follow COVID. They're back to work and they just, what, I don't want to hear it no more. It's depressing. But there's still a lot of us that actually pay attention and follow the developments that's going on throughout the world and throughout this country. So when you hear all of these things that's going on from experts and not politicians, then when you hear this type of message being sent by our state leadership, it it deflates you. It really does, man. I mean, the other day, Charlie, I was outside. I transplanted some of my vegetables, and I was like, you know what? I don't know what to do already. I honestly sometimes feel like just throwing in a towel and tuning out, just tuning out, and just wear my mask and do what I gotta do, and just pray that that no one gets sick and dies. We had a scare yesterday, day before yesterday. My niece, my sister's daughter, in she's in Oregon as well, and she had contracted the H1N1 back many years ago.
Hmm.
She almost died. We almost lost her. She was in a induced coma for a very long time. She was actually, I think it's at Straub or Queens. One of them, they have the bed that rotates
Yes.
very,
Straw. Straw.
very slowly. It just rotates. Anyway, so she came down with severe COVID-like symptoms day before yesterday,
Oh no.
and she's very vulnerable. Um, and she was in the ER. She had a very hard time breathing, and thank God her test came out negative. She's home resting, but
Yeah, pneumonia.
what a scare! It wasn't pneumonia either,
Wow.
And all I can think about is, I mean, is it another variant? Is it another variant? Maybe is it another extension of COVID that the test doesn't pick up? Because it's not pneumonia, it's not COVID. What the hell is it? And as we start to open up, we're going to have more and more visitors coming from international locations, going to the mainland, popping over here. Uh, I just hope that we are not moving too quickly here in Hawaii. I know my daughter told me last night that next week Oregon is open up. None of you wear masks. I told her, please continue to wear your mask. Even though they lift the mandates for inside businesses, please wear your mask.
Right.
Uh, it's scary times, and I just don't get the feeling of concern from our decision makers that I think we should be getting at all.
Well, I do want to say also that sometimes we have fought this fight so hard, but it almost thinks we never said we're doctors, but we came pretty damn close to calling things right on the spot, right? And it almost seems as if they're saying, you guys don't know what you're talking about. Then I want to ask those in positions of leadership, and why do I feel this way? And I don't make up this stuff. You guys are part of the situation too. Yet, when we have something really bad happen, the state is really good at toning things down so it doesn't create a panic, right? They're really good at that. So if they're so good at that, why don't you be real good at telling us stuff like you have the unemployment situation fixed? You haven't said anything. Ever since they talked about what plans they're going to do, they left it at that. and everybody got distracted. Not nobody brings up the fact about unemployment. Yet you get the director who's like a cheerleader. Like she's doing a lot of rah rah, and pretty, that's pretty much it. You got a lieutenant governor by credentials. He's a medical doctor, but it's like me. I can be on a SWAT team, but if I go qualify every time and I can't even hit the target at 25 yards, but yet they keep me on a SWAT team because I bring food to the unit. But people don't know that. They go, "Ooh, Uncle Charlie on a SWAT team." Yeah, but Uncle Charlie cockeye, I never hit one target in how long? Should I put me in one sniper position? I probably hit the wrong person. That's what I'm trying to say. There's things going on around us, and just nobody's just nobody's just giving information to us that like they should. They just say, "Yeah, don't worry about it. It's gonna go away. Don't worry." And then we read about, you know, for the last week, always get one death, two deaths, one death. Just imagine every time you read about somebody dying, and I don't know if there's family involved or not. Just think about it. How many tears are shed? How many family members are crying out of pain because their loved one is lost? You think about it. That's why they make them. The percentages are small. Yeah, if you're not that, if you're not that percentage that is part of that the individual that's dying, yeah, you can talk big if you're not dead. You
Yeah.
try to have your family member get taken away. That's a different story. It's a different story.
Well, you would think that in the last year and a half, especially Josh Green would have, and maybe not because he's an ER doctor and he works like a very few long-houred shifts. So maybe he hasn't. I mean, yeah, he got the virus, but maybe he hasn't really been emotionally involved or attached with someone that died of COVID or a family member that died of COVID. Maybe it just hasn't hit home. Um, Maybe it just for them it's just the numbers, and that because our numbers are low compared to some of the other states, they think they're doing a good job. Maybe I don't know.
You know,
It's when they announce the numbers before the deaths of COVID when they do their press releases. That's insulting to the family. I think the death is much more newsworthy. I think that's more important than the number of cases. When you come out and say we had 3 deaths today, the numbers dropped, but we had 3 deaths today. I mean, that 3 deaths are that's major. But I don't know, Charlie. I don't know what it is. I just don't. And I understand they want to keep the potential chaos down in the state. They want to make sure no one's freaking out. But at the same time, I think the people deserve to be told the truth. I think the people deserve to be, because we're getting it from other people. We're hearing it from other experts, and we're not getting that message here. And I think that's where a lot of people have lost trust, have lost faith, and they're doing what they got to do. The good thing I think in Hawaii is many of us, I think most of us follow the rules. I think most of us wear the mask. I think most of us do what needs to be done to keep ourselves and our loved ones safe. Thank God. Because if we were one of those free living areas like the mainland where no one wears a mask, the gatherings are crazy. They get the beach parties. Oh, I think it'd be a different story. So I think the mahalo goes to the people who have sacrificed for the last year and a half and did the right thing. I really do. I believe that with all my heart.
well,
I just hope we can.
you know, I, I did want to say that, I'm very optimistic. I'm very, very optimistic. But you will not hear me tell you that I'm so optimistic. I'm going to have you try and do something foolish. There's a difference. You can be optimistic, but still yet have a small percentage of concern because the what if exists, right? The what if. What if this happens? And I think some of these individuals that give us these news, they don't take into account what if it turns sideways on us? Because as long as it doesn't affect them, who cares? I care. I care when they should be telling people, hey, get landmines over there, no walk over there. But they're not saying that. They're just saying, go, you're going to be okay. We put the flags so you can avoid hitting the mine. And like I said before, monkey fall out of trees. Airplanes fall from the sky. So I care. I care very much.
Never mind you step on a mine because we can fix them up in the ER. We get available beds. You know who I really, 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 really feel for right now. As I watched that press conference, I really feel for our frontline medical workers, doctors, nurses, everyone that's working in those hospitals. That's that have been going through this for a year and a half, waiting for this thing. And I think the last couple of the month or so, numbers have dropped. And giving them some opportunity, to rest a little bit. And that's probably not a good word because I don't think they ever rest. But compared to what it was a year ago, can you imagine how they feel tonight now? I mean, knowing, they know the capacity of the hospitals. They see the hospital beds filling up. And yeah, non-COVID, but nonetheless, they know how quick things can turn for the worse with a small cluster. I feel for those people right now. I feel for those people that are working, dreading what can happen with this new variant. That's who I really, really, really feel for. And then how when you feel helpless, Charlie, and you feel like there's nothing you really can do except pray for them. I hate that
Mhm.
feeling, man. I hate that feeling. I do.
Uh, I I want to shift a little bit and say that at 62, I never thought I'd be working these kind of long hours, but but I find it in a way very invigorating because I'm testing myself and I tell myself, hey, this I call myself an old man. This old man still can go. Little creaking here and there, but yeah, I still give them. You know, these 16, 18-hour days. And the thing is, by the time we get off, you know what the dreaded part is, Mel? Driving home to Waimea at like quarter to 12, especially on the weekends. Get all these Lolos. Just they think they're Mario Brothers the way they're driving on the road.
Yeah. Wow.
Bunch of crazy. But hey, I never lose my temper. I never try to pull somebody over and try to stretch them. I just say, well, and you know what's really funny? They they fly past you, right? And yet when you come to the traffic light, they're right in front of you. They never gain anything. They just when waste gas, just stepping on the pedal, blast you. I said, oh, a bunch of monkeys. But this old man still can go. I still got it. So thank you, Lord.
That's it, man. I tell you, it's more and more important, and now more than ever that we gotta thank God every single day, and we gotta ask God for help because we
Yeah.
need it. People may think I'm crazy, Mel. You losing your mind? No, I'm not losing. My mind was lost a long time ago. But I'm a realist. I'm a realist, and trust me, I pray for every one of you every single night, whether you know it or not, whether you believe in God or not. Um, I saw a post today. Somebody posted on Facebook that really hit home. It says, "Do you remember when you asked God for what you have today?" You know, because whenever we get into trouble or whenever we go to God and we say, "Hey God, please, can you make this right for me?" Hey, God, please, we're trying to buy a house. Hey, God, please. And then we forget about it, right? You get your house, you get your better health, you get out of your crisis, and we forget to go back and thank God. Remember the time you asked God for something that you have today. What a profound little quote that I will never forget. I just saw that on Facebook today and it made so much sense. I have prayed for every one of you every single night since we started. Not a very long prayer. Sometimes it's a very short prayer. I pray for our governor and all our leaders to give them wisdom and strength and guidance. I don't know what is that. I don't know. Sometimes
I
I
I
think,
I know I know we pray for forgiveness because while we pray for them, we also ask for forgiveness because right when we all pray, we start bashing them again.
you know,
We don't give them.
we get accused of bashing a lot, and
No, it's not,
if you call,
brother. It's not bashing. We're just talking on certain code
yeah, yeah.
that doesn't sound pleasant.
Well, I think this venue of this show is really to share. Now we have a lot of viewers, and I keep seeing the same comment coming up. So and so is watching. I don't know. The comments are silly on Facebook. It's not working right, but feel free to comment whether you agree or disagree or what. I posted today. I was watching the news. They had a picture on the screen about we surpassed the 600,000 deaths, COVID deaths in America. I ran, got my camera, took a picture, I posted it, and I said very simply, prayers to all affected. One of my very good friends posted, and he said, I think the numbers are inflated. I don't think that's accurate. Now, that guy's like a brother to me. Now, am I going to lose my friendship with him because we disagree? Absolutely not. But that's what this venue does. Gives every single one of you an opportunity to share your thoughts right there in
Mhm.
the comments. And it's safe here. If you come out stupid and you say stupid things, yeah, you will get blocked. But we are very tolerant because we respect everybody's position and opinion. But what Charlie and I do is we spend a lot of time trying to figure out what was the events of the day or the week, and then we just share it with you folks. And most of you already know what we're talking about. Some of you don't. So if people get butthurt because we mentioned their name on our show, no, watch the show. No, watch the show. Uh, and I know, trust me, I got personal text from the lieutenant governor telling me I'm listening to the wrong people. I respect his opinion. I disagree. I think I'm listening to the right people, and I think he's listening to the wrong people. Would that affect our friendship? Not for me, maybe for him. By the tone of his text, I don't think he likes me anymore, but that's okay. That's fine. This is the deal. This is a forum for all of us. So we encourage you guys to drop some comments. Agree, disagree, whatever. It doesn't matter. Just be civil. Just be civil. You
Mm.
know, that's what we try to bring you folks every Monday, Wednesday, Friday. By the way, on Wednesday, guys, we get Mayor Kawakami and Dr. Behrman. They'll be on at 7 o'clock. So please set your calendars, your alarms. I'm totally interested in hearing what they have to say, especially now with the variant arriving uh, today, or it arrived a while ago, but discovered and announced today. I'm really, really interested to see Dr. Behrman's response and if it's in line with. I'm assuming it will be, but I'm just curious because she's been a very straightforward guest on our show in the past.
This past week I've been getting up real early, like quarter to four, 3:30, quarter to four, get ready to work. And I didn't know there's this new alarm. I don't know if you ever heard of it. It works really well and it doesn't make noise. This the how this works, and I would urge all of you. What my wife does is she'll roll up in the blankets, take all the blankets, and turn the AC on. so cold that I have no choice but to get up and jump in a shower and turn on the hot water. That's a special alarm. So I don't need to hear nothing. Just get this Kanaka cold. And boy, I'm gonna get up. Even as tired as I am, I'm gonna get up.
Yeah, I've been waking up early. I'm not sure why. As you can see, I drinking water because the coffee was really affecting my sleeping patterns. I lied to
Man,
myself saying that it never did, but yeah, I couldn't get a real good sleep. So I was drinking monster drinks or coffee during the show, but now it's just right out of the water. And so I ain't nothing like a good night's sleep. And I think and people talk a lot about the pandemic bringing depression and anxiety. And I gotta tell you, man, I don't think it's depression, but I definitely this COVID pandemic over the last year and a half has definitely brought some anxiety. Charlie, you and I we're cut from the same cloth. You think
exactly.
about it, right? All first responders, when you have a crisis, you are in a position to offer immediate assistance,
Right.
right? Charlie, till today, I mean, if you go to the restaurant, you see an argument, you're going to step in. That's just how we're built. That's how, most people can call 911. We can just, so I think the anxiety comes in when you see what's happening around you and there's nothing you can do, Charlie, except wait till our show so we can vent and share and talk about it. Hopefully the right person hears it. But I think that the fact that we feel so helpless, that because we
Hmm.
cannot step in the middle of two guys arguing, we cannot console someone that's having a crisis. Like that's what we did. That's what we do. So when we get into a situation like this, and we try, and and it just feels. I don't know how you feel, but I just feel so helpless. This show does fill a void, but at the end of the day, when you look at the result, did my efforts make a difference? It didn't make a difference because decisions have already been made, and the decision makers do not have an open mind. They have made the decision,
Hmm.
and it's like when it's fourth and long, you got to make a decision at the time. What do we do? Do we punt or do we run the ball? In some
Well,
cases, the coach before the game will say, if we have a fourth and long, we're going to punt. Regardless of what the circumstances, we're going to punt fourth and long. And that's kind of how I feel. These guys have made a decision, regardless of what happens today or yesterday, that may change the whole what's going on. It doesn't matter because the deadline has been set, and we're going to get to that deadline, and we'll deal with the consequence. That's that's the frustration. I don't know if you share that, Charlie.
you talk about two guys fighting, you will step in. I'm the type, if two people at the restaurant fighting, I'll go out. I'll try not to get in between the fight, but I'll ask them, excuse me, sir, I see you didn't touch your beef broccoli. Can I have it? While you guys argue. That's what I would do. That's the pocket side of me. Okay. That's the pocket
I
side
t-
of me. You're gonna argue, you waste your food. Eat your food, give me. But I do want to say, the wife said, gotta take better care. Gotta take better care. And she's right. So I'm proud to say that in the last couple of weeks, I lost 8 pounds. I'm feeling good. Clothes getting a little loose. So I'm gonna keep it going. I'm gonna keep it going. So I can
well,
get down to my target goal. And I'm
I,
happy. I'm happy.
and we got your back, bro. We got your back because
I'm
Patsy
happy.
made some brownies that we normally would give to you.
But there you go. How do you have my back when you say, it's like you're a caged animal go here. You hungry? Here. But
No,
this
you
not
see, I,
your
ne-
idol.
I never tell you I had brownies, and it's the Kamehameha School Howley brownies, Charlie. So
There you go. There you
that,
go.
but listen, the other day when I called you and I said, "Do you need anything?" You said, "No, no, 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 no." Because I
Because you
know
never tell me what to do.
exactly. If I said it was Holly Brownies, you would say,
I would go, yes, 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 yes.
"We're all in this together, bro. We're all in this together, and we gotta help each other out. We gotta help each other
Yeah,
out, and yeah, we gotta take care of our health. We gotta be healthy for our families, our loved ones, and that's what we all gotta do together, man. So if
yeah.
anybody bring you stuff that you're not supposed to eat, just let me know. I can pick them up.
I tell you, I've cut out all the rice, the starches, right? And I turned on to the tofu. I tell you, I can eat tofu 9 million different ways. I never ever thought I'd fall in love with it. I eat tofu with eggs. I eat tofu with fish. I just, and it's psychological. You know, it could be I don't even taste the tofu, but I just say I look at it, it's good for me, and it takes the place of rice. That's the way I look at it.
Well, the reason you know can taste them is because tofu no more taste.
That's right.
But Patsy make tofu with everything. She make with ground pork. She make with with tofu, ground pork, and vegetables. We haven't eaten rice in a long time. Every so often we'll go out. We did our lives when we went out to a place to support local. We'll eat some of the rice, but I haven't eaten rice in a long time. I was 248 pounds when I got my gout attack, first time in my life.
Oh boy.
All the red meat. We ate chicken and vegetables for 3 months. I lost 35 pounds. I went down to 203 pounds.
Hmm.
That's rapid. No diet pills. No exercise. Just cut out the rice and the fat and the soda and the juice. Um, our doctor the other day, I said back up to 213, so I gotta pump the brakes because I don't like go back there. It's no good. I had to buy new pants, but that's cool. But
And
we all gotta take care of ourselves, man.
and I'm back. I neglected to do it, but I just got disciplined. I went back and had the doc prescribe me. I poke myself every morning just to see where my sugar is at. And the time I went into the ER, I think it was at 298. That was way too high. I should be like between 90 and 110. Then it went from 170. Now it's down to 140. It's slowly coming down. And a lot of it has to do with losing the weight and just taking care of yourself. The only thing that's disruptive is my sleep because sleep is you kind of want to get a good 6 to 7 hours of sleep, and it's tough. But the funny thing about it, I get 4 hours of sleep, but I'm not binging. Sometimes when you get irritable, you grab something, try to put them in your mouth, you start eating, right? I've been doing really good just with the unsweetened tea or uh, just ice water,
Yeah,
and it's been working out. It's been working out.
the ice water is the magic.
But I'm gonna try. I'm gonna try. There's this thing at Home Depot called Miracle Grow. I think if I drink some, they'll grow back some hill.
That's what I use, Charlie. That's what I use. The Miracle Grow. You dilute them though. You gotta no use the straight
Huh?
shot. No, gonna burn, gonna burn.
I was doing this right. When we started the show, and as you talk, I checked the comments. I look down.
Yeah, that's what I doing.
When I look in the when I look at that stuff, I go, hold up, bugger, gone. So
Yeah,
so one of my friends in the class told me, bro, just shave the thing off. I said, if I had on GQ looking head, I'll go bald head. But right now, I think my head look like kind of pinball hammer. Look like one of that. I said, no, no, no,
yeah. You know, I wish my head is so disfigured because I tell you, I would love to shave my head bald, but it just wouldn't work out. It would not work out. Nope.
And folks, I know you thought I was gonna say something about Snickers, but I've been really good. I've been really good. In fact, I still have one in a ice box, and I cut small pieces, and that one Snickers bar has lasted me like about almost a month. And usually I'll have a little when I eat fish. For some reason, if I eat sashimi, raw fish, I get the craving for sweets. But I'm glad I can control myself. I don't polish the whole thing off like I would before. It's just I take a little. But it's like, you know, I think I got to get psychiatric help because I get voices talking in my head. Like one says, "Come on, eat some more." Oh, you can't eat some more. I go through all of that.
Yeah.
But then I
Good
got to
for
a point that
yourself.
I tell both of them, "Shut up," and then everything quiet. So the candy bar still stays at ice.
What you do is you have Stephanie put one celery stick in the Snicker bar.
No,
Put one celery stick, and then
no.
fill up the
I
celery
ain't
with
one of them.
water.
When you put that not cream cheese, but you put tuna spread on a celery stick, right?
Yeah.
I am one of those. I scrape all that filling, throw it at celery, and eat the filling. That's I'm one of those. But hey, I gotta admit, I'll eat celery because before I was one of those. I spent 45 minutes. Supreme pizza before Pizza Hut. I take every bell pepper, everything off. But now I go for it. I'll eat everything. Proud
Bro,
of my
you take
Chinese
the
food. I'll eat everything.
you
I'll eat everything.
take the ground turkey. Get the ground turkey, and you put the onions, bell pepper, celery, and you just stir fry that bugger, boy. I'm telling
You
you.
know, this is what I did with. I had some turkey. I put a little bit chestnuts, salt, pepper, a little bit oyster sauce, right? And I would get shrimp and mince them up and mix them into that. I take a spoonful. I cut out, take the blocks of tofu. I dig them out and I put that inside there, like pork hash. Then I put them in a steamer. Then right when I think ready, I take chicken broth. I thicken them up with a little bit shoyu, and I drizzle that sauce all over.
Whew, I'm still hungry, Charlie. I'm hungry. It's the
Woo.
perfect timing. It's 8 o'clock. Time to eat. What's your
Since you
final
told me,
thoughts? What, huh?
since you told me about Howley brownies, I will give you my pork hash imitation special.
What's your closing thoughts there, Charles?
My closing thoughts is this: I cannot thank everyone. I cannot thank them enough for the love and support, and more so for the love that they have for one another. Because when we first started, everybody had different views. But from Melissa to Nani to Jesse to Keala to Raylene to Jane, right, to Amy, and the list goes on and on to Morale, right, to Cynthia, to Brenda. I cannot thank you enough because you folks have shown me what caring for each other is like. Because not only have you cared for Mel and I, but I see how you folks communicating on the threads like long lost sisters, talking story. And that's what it's all about. You folks building up that bridge and you folks keeping in touch, even though we may be on different islands, you folks are all keeping in touch with one another. And I love that so much. And I cannot thank you folks enough. So thank you. In fact, it's almost to the point I get in tears, so I better stop because you don't let you this ugly baby cry. But thank you from the bottom of my heart. Mel?
Well, thanks, Charlie. I feel the same way, man. I mean, it's that's the one thing that um, I think we all got out of COVID was the opportunity to to become an ohana again, and people we've never met.
Yep.
And when Charlie puts on his concert, we're gonna be able to see everybody face to face.
I just
And
wish
oh,
one
by the
night
way,
I can get through without that concert.
well, I want to just say because I met with Warren Haruki last week.
Uh-huh.
We had talking about something else, and I told him we have the use of the Puhi field We'll put up the big stage with the huge screen for the entertainers so that everybody. I mean, it's falling into place, guys. It's falling into place. So I cannot wait for that day.
And I want to make it happen where we find a way to bring our sisters and brothers, our Ohana, that watch us, even if like Lana, right? Lana and the gang, Leah and the gang, they're all on Oahu. I wish we find a way to bring them over here. If it's just for the weekend, that's what I like to do.
We'll see if my private jet is available on that weekend, Charlie. I'm totally serious, guys. We love you guys like family, and we concern and care for you guys. So that's why we do what we do. We want to make sure the message is there, guys. Wear your mask, social distance, disinfect yourselves, do everything you got to do, because regardless of what COVID
Yeah.
decides to do, whether Delta spikes up our numbers, we protect ourselves. If you haven't gotten vaccinated, you're on the fence, please seriously consider it. If not, please, please, please protect yourself, guys. We will get through this. We will be at that concert one day, and we're going to get to meet all you folks face to face Wednesday night, 7 o'clock. Mayor Kawakami, Dr. Behrman on our show. Please be here. If you guys have particular questions that you want me to ask, send them to me in Messenger or send them to Charlie, because once we start the show, it's very difficult to keep up with the comments. All right. Wednesday night, 7 o'clock. We love you guys. God bless. Take care. Stay safe.
Aloha.
Aloha.